ਯਾਕ ਸਾਊਥ ਵੈਸਟਰਨ ਤੋਂ ਐਨਡੀਪੀ ਪਾਰਟੀ ਦੇ ਐਮਪੀਪੀ ਫੈਸਲ ਹਸਨ ਨੇ ਵੀ ਸਿਹਤ ਮੰਤਰੀ ਕ੍ਰਿਸਟੀ ਐਲੀਅਟ ਅੱਗੇ ਆਪਣੇ ਹਲਕੇ ਦੀਆਂ ਮੁਸ਼ਕਲਾਂ ਚੁੱਕੀਆਂ। ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ ਉਹਨਾਂ ਦੇ ਲੋਕ ਕਰੋਨਾ ਕਾਲ ਦੇ ਵਿੱਚ ਕਾਫੀ ਦਿੱਕਤਾਂ ਦਾ ਸਾਹਮਣਾ ਕਰ ਰਹੇ ਨੇ ਤੇ ਅਜਿਹੀ ਔਖੀ ਘੜੀ ਦੇ ਵਿੱਚ ਮੁੱਢਲੀਆਂ ਸਹੂਲਤਾਂ ਵੀ ਨਹੀਂ ਮਿਲ ਰਹੀਆਂ, ਜਿਸ ਤੋਂ ਬਾਅਦ ਸਿਹਤ ਮੰਤਰੀ ਨੇ ਆਪਣਾ ਜਵਾਬ ਕੁਝ ਇਸ ਤਰ੍ਹਾਂ ਦਿੱਤਾ।
I have stood in this house many times speaking about how my community of York South Western has been neglected and left behind in this government's COVID-19 response. My writing is a pharmacy desert. When it comes to vaccine access, we only have 8 pharmacies in a very large riding. We do not have a permanent facility for vaccines for seniors. I am now hearing that those few pharmacies do not even have adequate supply for people. Why the inequities and why are residents, those essential workers and seniors, not getting equal access to vaccines from the government?
Minister of Health.
Thank you, Speaker. Well, as the member will have heard today by my responses to many of the questions about why members feel that their area is not receiving an equal volume of vaccines, the answer remains the same: lack of supply. We are waiting to receive the AstraZeneca doses that will go into pharmacies, 3 in every public health unit region, but we need those vaccines. They're coming into Canada from the United States, going to the federal government, but we need to know when they will be coming to Ontario. Until that happens, we can't supply any more to pharmacies other than the remaining supply that they already have, which will be expired as of April 2nd, and we're going to make sure that not one dose is wasted, that they go into someone's arm. So we need the new supply. That's what we're waiting for. That's what we've asked the federal government for.
And the supplementary question.
Thank you, Mr. Speaker. My question is back to the Premier. The lack of pharmacy locations and the complete lack of a permanent facility to distribute vaccines highlights the health disparities in York South Western, my community. That is not only bad public health policy, but it is discrimination along black, racial and economic lines. Our high-risk, hotspots, hard-working community deserves the pandemic protection they deserve. Why is our hotspots community continue to be left behind, and what are your government's plans to finally address your COVID inequity response in this regard?
Minister of Health.
Thank you. Well, as the member will know, there is one vaccination plan that is being rolled out across 34 public health unit regions. That is the plan that is happening based on age, based on risk. The local medical officers of health have been working with Dr. Williams, our Chief Medical Officer of Health. Dr. Davila will have arranged to make sure that all parts of Toronto will have places for vaccinations for all people. This is available through the mass vaccination sites, through the pharmacy sites, primary care, some specialty care sites, and mobile units. This is happening equally across the province. Right now, people are being asked for their socio-economic data when they appear for a vaccine, if they wish to provide it, so that we can plan for future healthcare decisions, and that is really important information. However, if people choose not to provide that information, they will not be denied a vaccine. Anyone who wants a vaccine will be.
ਸਾਡਾ ਹਰ ਇੱਕ ਪ੍ਰੋਗਰਾਮ ਦੇਖਣ ਤੇ ਸਾਡੇ ਨਾਲ ਜੁੜਨ ਲਈ ਸਬਸਕ੍ਰਾਈਬ ਕਰੋ ਚੈਨਲ ਪੰਜਾਬੀ ਤੇ ਨੋਟੀਫਿਕੇਸ਼ਨ ਲਈ ਬੈਲ ਆਈਕਨ ਵਾਲੇ ਬਟਨ ਤੇ ਕਲਿੱਕ ਕਰੋ।